Hello my good people, welcome into my lesson. Today I want us to learn about this family planning method called coil. Today I want us to learn about coil or IUD coil. And by the way, what is an IUD? IUD coil, this is an intrauterine device, IUD or coil. And we have two types of coil. Please watch until the end of this video, whereby I'm going to teach you about this coil, advantages of coil, disadvantages of coil. Then I will show you with a video here how coil is inserted. Then also I will show you how coil it is removed. Then the side effects of coil. Then finally, who is not supposed to use this IUD coil. Please watch until the end and you will learn more about this IUD coil. Let us start with, we have two types of coil. Two types of coil. Number one, hormonal, and number two, non-hormonal coil. Let us start with hormonal coil. The hormonal IUD, number one. This is made up of plastic and releases hormones. The hormonal IUD, this is made up of plastic and it releases hormone. Number two is the hormone that it is the copper that is commonly used by many women, almost 98% of women. That is the copper IUD. Now number one, the hormonal IUD, and number two, the copper IUD or the copper coil. Now this copper coil, this is made up of copper or plastic, which does not release hormones. That's why it is used by many women, because it does not release hormone and it does not interfere with hormones. Then today let us look at this copper hormone or copper coil, the copper coil. Copper coil, the IUD copper. What is IUD? IUD, this is an intrauterine device, also called IUD or copper coil. It is a small, flexible, often T-shaped device that is placed inside a woman's womb or uterus by a trained healthcare provider. It can protect against unwanted pregnancies for up to 10 years, period. But it can always be removed and a woman will return to her previous fertility level. Let us look at some tips here about this copper coil. Note better, number one, this copper coil, it gives 10 years protection against unwanted pregnancy. Number two, when inserted correctly, IUDs coil are more than 99% effective. Number three, it can be taken out at any time by a specially trained doctor or nurse. It is then possible to get pregnant straight. Then let us look at the advantages and disadvantages of this IUD copper coil. And we start with advantages of coil. Number one, advantage or goodness of coil. Advantage number one, it is very good in preventing pregnancy. Copper coil, it is very good in preventing pregnancy. Number two, it is long lasting. Remember, I've told you that it goes up to 10 years. It is the good family planning method and the longest family planning method. So number one, it is a good for preventing pregnancy. Number two, it is long lasting. Number three, it is cost effective. Number three, it is very reversible. It is very reversible in case you want to get pregnant. That is number four. Number four, fertility returns quickly and even higher after removal. And number 6, hormonal makes period higher or less painful. So those are the advantages of coil. It is the best method, it is long lasting, it is cost effective, it is reversible in case you want to get pregnant. Fertility returns quickly and even higher after removal. Then finally, hormonal makes period higher or less painful. Less painful, not like the other methods such as 3 months injection, that is the Depo-Provera or pills. Let us look at disadvantages. Which are the disadvantages of IUD copper coil? I want us to look at 3 disadvantages. Number 1, copper coil, it has small risk after insertion. Small risk after insertion. For example, pelvic infection. Number 2, irregular bleeding or spotting. Disadvantage number 2, irregular bleeding or spotting. Number 3, heavy and painful menstruation period, initially 3 to 6 months. Let me explain this. For those women who insert coil, copper coil, they observe, majority of them, they observe heavy and painful menstruation period 3 to 6 months. Then from 6 months it will be okay. You'll be receiving your regular menstruation period. Then, note better, the copper, note this point carefully. The copper IUD coil is inserted 7 days after menstruation period. So copper is inserted 7 days after menstruation period, and if so, it works. Its work starts off immediately. Now, if you see these, I'm going to state 4 factors. Please see doctor. If you see these 4 observations, please visit your doctor. Number 1, if you observe painful period, abnormal or painful period, visit your doctor. If you observe heavy bleeding, please visit your clinic, a clinic officer or your doctor. If you observe abdominal spotting or abdominal bleeding, please visit your doctor or your gynecologist doctor. And number 4, if you experience a smelly vaginal discharge, please visit your doctor. So, let me repeat this. If you observe these 4 things, please visit your doctor as fast as possible. Number 1, abnormal pain. Number 2, heavy bleeding. Number 3, abnormal or spotting bleeding. And number 4, smelly vaginal discharge. Then who is not supposed to use this coil? It is not inserted to a woman with cervical cancer. Number 2, it is not inserted to a woman with uterus cancer. Number 3, it is not inserted with a woman who is suffering from STIs. So coil is not inserted to a woman who has sexually transmitted infections. And coil is not inserted to a woman who has abnormal bleeding or unexplained bleeding. Also, it is not inserted to pregnant women. Thank you so much for watching. This is how coil is inserted. Can you see into this video? This is how it is inserted. Can you see how it is inserted? So I have shown you how coil are inserted and how also coil is removed. And remember, after the removal of coil, infertility gains immediately and you can get pregnant directly. I've shown you how it is inserted. Thank you so much and God bless you. Thank you.